Hi everyone, welcome to the Ritu Podcast Show. This is season 2, episode 4. Today, before I introduce all of you to my guest, I just want to say that this is one of a very important day of my life because I hold Dr. Singal really highly. I respect him very much, and we'll go further down the line how it came about this way. But yes, my guest today is Dr. Dinesh Singhal. He is a board certified cardiologist with decades of experience and practices at Cardiometabolic Institute in Somerset and Monroe, New Jersey. I'm just a disclaimer because there's a big list of Dr. Singhal's achievements, so I'll try to keep it concise because we have a lot to talk in less time. He's a gold medalist in pre-med class and graduated from AIMS, All India Institute of Medical Sciences, one of the top medical colleges in New Delhi. He's actively involved in clinical research, has been a PI in numerous studies. He's currently a clinical associate professor at Drexel University College of Medicine. He's also actively involved in residency facility programs, teaching programs at Robert Wood Johnson. And also, he hosts a radio show called Heartbeat on ABC Radio 1170, which is a popular show that covers a variety of medical topics. He was also voted top doctor by New Jersey Monthly Magazine in 2014. So that's just a small list of Dr. Singhal's achievements. But over to you, Dr. Singhal. Would you like to introduce yourself more than what I already did for my viewers?
Well, no, you've been very kind. So I, uh, uh, as you pointed out, I'm an interventional cardiologist and have been in the New Jersey area in practice for over 30 years or so, and enjoy all facets of practice of medicine, whether it's seeing patients, taking care of them, clinical research, education. So it's been a very fulfilling career when I look back. Yeah, thank you for the kind introduction. Yeah.
Thank you, Dr. Singhal. So, as I mentioned earlier, Dr. Singhal, the podcast runs for 30 minutes and we have so much to talk about, and your life is so enriching that probably 30 minutes wouldn't be enough to cover. But my personal interest for having you on this show today was Dr. Singhal is sort of personal a little bit because um, I just think when I think back about my career, my life, I always think of people who have made a significant mark in you know making my journey the way it is right now. And I feel like I think we all meet such people in our lives and who just give us a direction sort of which we ourselves are not able to uh, project for ourselves. So that's why I wanted to bring you on, Dr. Singhal, because there are so many students out there, people out there who don't understand the importance of a mentor in their life, and I'm just going to quote Sadhguru from one of his interviews where the interviewer asked him, "Why do you think mentor is important in someone's life?" And he says that he's just like a GPS. If you are in a unprecedented terrain and you don't know where to go, then you go to GPS and it tells you how to go, where to go. So that's my take on it. So tell me, Dr. Singhal, like let's go back in India when you were growing up and you were going to school and you were achieving in flying colors, as we know. How did you grow up? Did you have people that really inspired you while you were growing up, or when you were in college, or when you graduated?
Yeah, you're absolutely right. We all need people who can sometimes guide us. I think it's a twofold thing. Uh, just the guide alone uh, probably is not enough. I think there has to be within us a voice which wants us to do better and achieve more. And then having a guide kind of gives you a bit of the direction of what needs to be done. So when I look back, I grew up in Delhi for the first few years before I moved to a city called Chandigarh. So, and when I think of my formative years in my second grade, third grade, I was kind of a middle of the class. My father, he was a government official, limited salary, but he was of the opinion that education was probably the most important thing in one's life. Send us to a private school, which was fairly expensive, uh, in the context of what he was making. And I remember sitting in the third, fourth grade in one of the annual events where awards were being given, and I saw students coming up who had done very well, and there was this little fire in the pit of my stomach as to the desire of why am I not there? And this I can remember as a third, fourth grade kid. And one of the probably the most important people in my life who gave me the uh, more the the who kind of fanned that fire of doing better was my father. And what I remember, what used to happen was that intrinsic fire was there. So I started working hard. As I went up the grades, fourth, fifth grade, I started moving up in at that time there was ranking in the class, and I started moving up in the class. But I remember coming home one day, and I think it was the fifth or sixth grade, and he asked me how I did in my exams in class that year, and I told him I stood, and I can't remember the exact rank. We were like 40 or 50 kids, and I said, well, I stood eighth or something in the class. I know I stood. I said I stood in the first top. I was in the first. I was in the top 10. And he said, "Well, what was in the top 10?" And I said I was eighth. And he says, "Well, okay." And that was all he said. And that made the point that there was room. And so before I left that school, I think I stood second. So there was these subtle um, uh, uh, in his eyes, you could see the desire that he should do better. He wouldn't say anything more than that, but that was powerful enough that it would motivate me. And so by the time I hit ninth, 10th grade, I used to be first in the class in every subject. So in India at that time, at the 10th grade, which is when I'm 15 years old, you had to kind of make a decision because we had to go to college at that time. There wasn't the 10 plus 2. So I had to decide what direction to take. So at that time, the only choices you really had meaningfully was medicine, engineering, or something else. And I'm 15, didn't know what direction to take. I asked my dad, I said, what should I do? I was decent in most of the subjects at that time. And he said to me, he says, you know what? Do medicine because, and his words were, a doctor never goes hungry. You never have to look for a job. And so that kind of triggered. I said, okay, so that's how I wound up in the field in which I am. The second person I can remember in my life who had a very powerful in school, I was in every single activity in high school you could imagine, whether it was plays, sports, studies, but as you get into college and the curriculum is more rigorous, obviously that all was not feasible. And there was a professor of English, his name was Professor Kamal in the college I went to in Chandigarh. The very first class, and the class was big. We were about 100 students in that one class. And he looked around and he said, look, welcome to pre-medical. The reality of the matter is that not all of you are going to go to med school. And he said, these are 2 years you have, and if you study hard in these 2 years, the rest of your life is going to be easy. You can take these 2 years to be easy, and the rest of your life is going to be hard. And that has such an impact on me that for the next 2 years, I didn't do anything but study. And as you pointed out, I was lucky enough to get into the top medical school in India. And but I remember, so again, along the way, there are people who will have an influence on you, and there are some other stories where which come, but I think those couple of people are really who I can remember had a big influence in the direction at a very formative age.
No, thank you for sharing that, Dr. Singhal. It's really what comes about is you're saying mentors definitely can inspire and guide you, but that fire has to be in you to go that direction and follow your passion and what you want to do in life. So, and also another thing that stood out to me, Dr. Singhal, what you said was, you can have these 2 years easy and then you have to struggle the rest of your life, or vice versa. And I think that sort of advice, even I remember when I was growing up, my parents did, and probably I didn't pursue that advice much. But now when I look back, I feel like I should have. So I keep telling my children the same thing, that you have to be focused, and I would definitely show this episode to my sons for sure, because they need to hear it. So thank you for sharing that, Dr. Singhal. But also, Dr. Singhal, I just asked you about who influenced you in your career and where your path. But just like myself, Dr. Singhal, I have seen you influence as a mentor several people around you, right? When I was working with you in the practice, I would see like the nurses, medical assistants, research staff, even anyone in the office, I felt did not was not untouched by or inspired by you. And even after I left, and people who joined you after me had a great career trajectory because they started with you and they went to be where they are now. So how do you how do you react to that, Dr. Singh? Like, how do you, because a person of your stature and reputation and the amount of work that you're handling and busy you are, you're still so humble, and like you make every other person feel as important as you are. So where does that come from, Dr. Singh, and how you keep it going that way even today?
I that's a it requires a lot of introspection. I don't, I am who I am. I guess one basic tenet I have followed at one point, I don't know if I read it or someone told me, this is years ago, that in life, each one of us, no matter what we do, we all play in our own ways, an important part in whatever we are doing. So, and each one of us can learn something from each other, no matter who it is. It could be the janitor cleaning the hallways, um, whether it's from their work ethic or whether it's from their personal life. No one is perfect. So that's always been my premise. So the humility, I think, just comes from that thought process that I'm not perfect. There's always room for improvement, and I think I can learn something from everybody, no matter who it is. And so just I don't think of it consciously, but I believe in it, and therefore I think the respect which should be there for every other human being, every other individual, I think just comes from that. Now, having said that, and you may have seen when you were working with me, I mean, I am hard on some people because I um, I expect everybody to put their best foot forward, and I have low tolerance for people who I believe as long as one's intents are right and one is trying hard, there is always, we all want to make mistakes. I will work with somebody to teach them, to educate them, to help them get better in what they're doing. But if they're not making the full effort, that um, um, somehow is hard to accept. And I think that lack of acceptance maybe stimulates the individual to be better because they want to. as long as there is a desire for them to reach those expectations, they will do better. So I set a high standard for myself in my personal life, and I expect the same from others. And so I think that expectation, just like my father, when I was growing up, and had set this high expectation of me, and I had to best to get to that level, even though there wasn't the daily um, badgering that you have to get better, uh, but you knew that that expectation was there. So I think somehow maybe that comes through to people, and then they do better. And once you start doing better, then you're going to excel because that's where it is. So I think that expectation, number one. Number two is the being a good role model. So I try my best to do right by whatever I get involved with. I'm very cognizant of the brand I build. So anybody I associate with, for me, every staff member, no matter whether they're on the front desk or whether they're at the back end, I tell them when I bring them on that you represent me. So we all have to get to the same kind of standard. And I think that hopefully helps them to do their best, to put their best foot forward, whether in their work or whether they're interfacing with others. And then some of it has to be from within. There are folks who are all of us in some ways have that sense of ambition. And I think once there is some direction, once you start excelling in what you're doing, then that gives the individual the ability to look for direction where they can grow. And I'm so thrilled and proud and happy that obviously that was not out of design, that there are folks who have been with me who have found opportunities and like yourself are doing much better in their careers. And that makes me proud, happy that I've been part of other people's life because I also learn and get inspired by every one of you who has gone out of their ways to do better in life.
No, thank you. Thank you, Dr. Singhal, for sharing that. And when you were telling me all those things, the times when I was working with you were reminiscing in my head, and I was thinking how everything that you said actually is true, because I was just going to give you an example, which is a very trivial one. I remember you were writing your notes and I needed to talk to you about the rest of the day about clinical research, and I had like a pad and a pen in my hand and I was writing down things what you were asking me, and he was like, why do you have a pen and a pen, this big thing, you can't remember five things? It's just a small thing, Dr. Singh. And I'm like, that's true. I can remember five things. I don't have to write everything down. So that has stayed with me. And even though I do write down things, but that thing always stayed with me, that I can try to remember things that I can try. I mean, I don't have to write everything down. So, and then another anecdote I want to share with you, Dr. Singh, was I remember you used to, I don't know if you still have those weekly Friday meetings with entire staff in the afternoon, but and you get updates from every department, like what's going on. And it was my first time that I was giving update, or second or third time, and I was just talking about a study that I was working on, and at the end of my update, you just said good. And later that day or next week, one of the other colleagues that I used to work with goes and says to me, you know what, Dr. Singhal said good to you. You know how you understand what that means? I'm like, yeah. So she was like, he never says good unless it's like really very good. I'm like, okay. So yeah, so those I remember those things, Dr. Singhal, and like I said, it has really a very significant mark in my life, not just as a professional, but also as personally. So thank you for that. So the next question that I had, Dr. Singhal, is, and we still have 10 more minutes, so I guess I can go for that. So I'll ask you this, Dr. Singhal, since you've been a mentor to several people, just not like myself, but even in residency programs, young doctors, Um, what has been your most rewarding moment as a mentor? If you can just pinpoint one that comes to your mind right now.
I can't think of, that's a tough one. I can't think of any specific moment, but um, um, again, I think it's just the gratification to see some of our students, some of the people I've worked with who have risen to, you know, it's like a parent who wants his children to do better in life, and once they reach some stature, that makes them proud. I think, I have now. I remember there was one resident who at St. Peter's who did a research project with me. She's now um, uh, a structural interventional cardiologist at Harvard. And similarly, there are people who are professors now, or at least in some education in different locations. You've risen from, I remember when you had no exposure to clinical research, and when you came on board and see where you are now. And so I think and there are multiple examples like that. So I think that is the biggest gratification when you see folks who have done well in life. There's a medical assistant of mine. We encouraged her, helped her. She got into nursing school and now is a nurse. Again, each person gets to a different level of um, uh, level of uh, they rise to a different level depending on what area they're in. But I think that probably is the most gratifying when you see everybody doing as well as they are in their career, and you feel um, that you played a small role, some role in where they are. Uh, so that inspires one to continue to contribute to whoever one interfaces with. Again, it's not out of intent, but or a design, but at the end, it's just teaching everybody, or at least hopefully encouraging people to do the right thing. So I can't give you a specific example, but I think just broadly seeing people do as well as and feeling that one was part of their lives, that is very satisfying and gratifying.
Mhm. Thank you. No, you did answer the question, Dr. Singhal. So, because I'm sure there may be so many examples. It's hard to just go and look for just one. So, definitely. Thanks. So, Dr. Singhal, before I let you go, I want to ask you this, and this is something that I just thought about is because I meet a lot of young people out there, a lot of parents who have kids in college or trying to decide what they want to do with their lives, career wise. And I see a lot of uh, I not say, I mean, people are getting, they don't want to do medicine as much as they wanted to do in the past because of the number of years they have to put in, and then they have to establish, and then the whole saga of, insurance and malpractice and everything that comes with it. What would you say to them, Dr. Singhal? Why is it still worth it to be a doctor today? in any day.
Well, I think our first answer I'll give is what my dad told me when I was 15 is unlike a lot of other professions where you may have to go around, hunt for a job, look for a job, and you may have gaps in time depending on what you're doing in that ability to earn a living. The one good thing about medicine is uh, you always will have a job. Now, you may have to decide make choices, but you will always in the medical field will always so you won't have to look. So now on the flip side, today's day and age, you may not make as much as somebody who goes into finance at a much younger age and does well. So I think, however, there is stability. So that's one. Two, like anything else in life, you have to want to do it to a certain extent also. So doing it just for the sake of either money or for any other reason sometimes may not work best. I've seen people who have done medical school and then gone and either not worked or did something completely different because the heart was not in it. So you do want to be wanting to do it. And, every so often you run into children who know from a relatively younger age that that's what they want to do. So I think if the passion is there, then, but in general, there is stability of work. It is a noble profession, although, like you pointed out, things have changed now, where sometimes you just become um, a person who is just triaging care rather than providing care because that's just the way the system is. So, but at the end of the day, all of us who are doing it from our hearts and want to take care of people, there is a sense of fulfillment, sense of gratification because you're actually helping somebody in a very meaningful way. I yes, yesterday, 2 days ago, I had to make a phone call to the wife of a patient who just passed away. 14 years ago, he almost died. He was on the, he had a heart attack. He was on the cath table. I mean, everything basically was shut down. I think I must have spent 5 to 6 hours with him, with multiple procedures. And he eventually survived and lived another 14 years, saw his daughter get married, have grandchildren, and his heart was very weak, was a very stubborn man, took a lot of effort to get him his medicines, but he died 2 days ago playing golf. And the wife was, I called her, I knew her, and every year she would send me a note thanking for one extra year of his life because she knew what we went through. And although we were not happy, or obviously we were sad and upset to a certain extent that he had passed away, but we both recognized that he had been living on borrowed time, but he had got 14 years. And I think that sense of having been part of somebody's life, having them lived through those extra years, um, that just is so gratifying. So I think that sense of fulfillment you cannot get no matter how much money you make, how many millions, billions you make. So again, it depends on where you're coming from. So I think it is still a noble profession. I think there is uh, still uh, that ability to make some meaningful impact on people's lives in a very, very meaningful way. So I think that's something one should have always consider. But one has to recognize it is hard work, it is a lot of effort, and it is not just for money. It is for doing the right thing, and then the money comes along the way. Stability of profession.
No, that's true, doctor. Thank you. Thank you so much. So with that, Dr. Singhal, we are at our 30 minutes. I just want to thank you so much. I'm so grateful for you to have come to my show. Like I said in the beginning of this episode, that this is that episode where I feel like I arrived in the podcast universe. So thank you so much um, for coming and agreeing to do this with me. It was a pleasure and honor to have you. So thank you so much, Dr. Singhal. And
Thank you, Ritu. I am so proud of you for all what you've accomplished, and I'm really appreciative for giving me a chance to be on your show. And good luck with it.
thank you, Dr. Singhal. And I hope we can come back again to talk some other topics someday.
Sure,
Thank you.
sure,
Thank you so
absolutely.
much. All right.
Thank you.
Take care.
Okay,
Thank you,
bye-bye.
Dr. Singhal.
Bye-bye. Bye-bye.
Bye.